Welcome to Public Health Brief. Heart disease doesn't start with a heart attack. It starts quietly, years earlier, through everyday habits most people ignore. Many people feel healthy but are already at high risk without knowing it. In this video, I'll explain the top risk factors for heart disease that everyone must know, why they matter, and how they silently damage your heart. This information could save your life or the life of someone you love, so make sure you watch until the end. Heart disease remains one of the leading causes of death worldwide, affecting people of all ages, genders, and backgrounds. Despite major advances in medicine and technology, many cases of heart disease are still preventable. The problem is not a lack of treatment options, but a lack of awareness about the factors that silently increase the risk long before symptoms appear. Understanding these risk factors is one of the most powerful steps anyone can take to protect their heart and live a longer, healthier life. One of the most significant contributors to heart disease is an unhealthy lifestyle. The modern way of living often encourages physical inactivity, poor dietary choices, chronic stress, and unhealthy habits that gradually damage the heart and blood vessels. Over time, these factors cause changes in the body that increase blood pressure, raise cholesterol levels, and promote inflammation, all of which strain the cardiovascular system. Many people feel healthy for years while this damage is silently progressing, making early awareness extremely important. Smoking is one of the most dangerous and well-established risk factors for heart disease. Tobacco smoke contains harmful chemicals that damage the lining of blood vessels, making them more prone to narrowing and blockage. Smoking also reduces oxygen in the blood, forcing the heart to work harder to supply the body. Even people who do not smoke themselves but are regularly exposed to secondhand smoke face an increased risk. The damage caused by smoking begins quickly, but the good news is that quitting smoking at any age significantly reduces the risk of heart disease and improves overall heart health. Poor nutrition plays a major role in the development of heart disease. Diets high in saturated fats, trans fats, salt, and added sugars contribute to high cholesterol levels, obesity, and high blood pressure. When excess cholesterol builds up in the blood, it can form plaques inside the arteries, a condition known as atherosclerosis. These plaques narrow the arteries and restrict blood flow to the heart, increasing the risk of heart attacks and strokes. At the same time, low intake of fruits, vegetables, whole grains, and healthy fats deprives the body of protective nutrients that support heart function and reduce inflammation. Physical inactivity is another powerful but often overlooked risk factor. Regular physical activity helps maintain a healthy weight, improves blood circulation, lowers blood pressure, and strengthens the heart muscle. When people live sedentary lives, the heart becomes less efficient, and other risk factors such as obesity and diabetes become more likely. Even moderate physical activity, such as brisk walking, can significantly reduce the risk of heart disease when practiced consistently. High blood pressure, also known as hypertension, is often called the silent killer because it usually causes no symptoms until serious damage has already occurred. Constantly elevated blood pressure puts excessive force on the walls of arteries, causing them to weaken and harden over time. This makes it easier for plaques to form and increases the likelihood of heart attacks, heart failure, and strokes. Many people are unaware they have high blood pressure, which is why regular screening and early management are essential. High cholesterol levels are closely linked to heart disease risk. When there is too much low-density lipoprotein, commonly known as bad cholesterol, in the blood, it can accumulate in the arteries and form blockages. At the same time, low levels of high-density lipoprotein, or good cholesterol, reduce the body's ability to remove excess cholesterol from the bloodstream. This imbalance creates a dangerous environment for the heart, especially when combined with other risk factors such as smoking or poor diet. Diabetes is another major risk factor that significantly increases the likelihood of heart disease. High blood sugar levels damage blood vessels and the nerves that control the heart. People with diabetes are more likely to develop high blood pressure and abnormal cholesterol levels, creating a dangerous combination for cardiovascular health. Even individuals with prediabetes are at higher risk, showing that blood sugar control is essential long before diabetes becomes severe. Obesity places extra strain on the heart and is closely associated with many other risk factors, including high blood pressure, high cholesterol, and diabetes. Excess body fat, especially around the abdomen, increases inflammation and disrupts normal metabolic processes. This combination makes the heart work harder and accelerates the development of cardiovascular disease. Maintaining a healthy weight through balanced nutrition and regular activity is one of the most effective ways to reduce heart disease risk. Chronic stress also plays an important role in heart health. Long-term stress triggers the release of hormones that raise blood pressure, increase heart rate, and promote inflammation. Stress can also lead to unhealthy coping behaviors such as overeating, smoking, or physical inactivity. Over time, these effects add up and significantly increase the risk of heart disease. Learning healthy ways to manage stress, such as relaxation techniques, physical activity, and social support, can have a positive impact on heart health. Age and genetics are risk factors that cannot be changed, but they are still important to understand. The risk of heart disease increases as people grow older, partly due to natural changes in blood vessels and heart function. Family history also matters, as genetic factors can influence cholesterol levels, blood pressure, and the likelihood of developing certain conditions. While these factors cannot be controlled, awareness allows people to take extra precautions and adopt healthier lifestyles earlier in life. Alcohol consumption, when excessive, contributes to high blood pressure, heart muscle damage, and irregular heart rhythms. While moderate alcohol intake may have some protective effects in certain populations, heavy or frequent drinking increases the risk of heart disease and other serious health problems. Responsible alcohol use or complete avoidance can significantly reduce cardiovascular risk. Sleep quality is increasingly recognized as an important factor in heart health. Poor sleep, short sleep duration, and sleep disorders such as sleep apnea are linked to high blood pressure, obesity, and diabetes. When the body does not get enough restorative sleep, it struggles to regulate hormones, blood sugar, and inflammation, all of which affect the heart. Prioritizing good sleep habits is an often overlooked but powerful way to support cardiovascular health. Heart disease does not develop overnight. It is usually the result of years of exposure to multiple risk factors that gradually damage the heart and blood vessels. The encouraging truth is that many of these risk factors are preventable or manageable through informed choices and early action. By understanding what increases the risk, individuals can take control of their health and reduce the likelihood of serious heart problems. Raising awareness about heart disease risk factors is not just a medical issue. It is a public health responsibility. When people understand how daily habits and health conditions affect their heart, they are more empowered to make positive changes. Education, prevention, and early intervention save lives. Knowing these risk factors is the first step. Acting on that knowledge is what truly protects the heart. If more people recognize the warning signs and take heart health seriously, countless lives can be improved and saved. So our conclusion is, heart disease is not only a medical condition, it is a result of choices made over time. The good news is that many risk factors can be controlled, prevented, or managed with the right knowledge and action. Protecting your heart starts with awareness and continues with healthy daily habits. If you found this video helpful, please like, share, and subscribe to the channel for more trusted health and public health education. Your heart matters, and informed choices today can save lives tomorrow.